my name is Kayla and I'm a student nurse practitioner with United States University. And today I'm filming the musculoskeletal video for our body systems assessment. Today is February 2nd, 2026. I can't believe we're in February already. And then this is my patient. Do you agree to being videotaped for education and quality purposes?
Yes.
And then this video will be posted to YouTube. Are you okay with that as well?
Okay.
Beautiful.
Thank you.
This is a video of the space that we're in. This is the floor, this is the ceiling, and then we're going to get started. Okay, so we're just going to get started, and I'm going to go ahead and start by looking at your hands. So we'll look at your hands while they're flat, and there's a little bit of a nodule noted at the knuckle in the thumb and forefinger. But that's pretty much it. Is there any pain when I touch like closer to the hand or further out?
No.
So that's proximal or distally on the phalange, and then a little bit of a nodule on the pinky finger or the fifth metatarsal. Beautiful. Or phalange. Awesome. And then I'm going to go ahead and have you open your hands like this and then close your hands. So abduction is in place and adduction is in place. And then I'm going to go ahead and look at this wrist. So I'm going to have you flex downward and then extend upward. Beautiful. And then go ahead and turn your hand over. Beautiful. And then push your hand backwards. Good. Do you feel any pain during that?
No.
Okay, beautiful. Then you can rest this hand and we'll look at this hand. Beautiful. And then there is a nodule noted on this finger as well, the second phalange. Not so much one on the thumb. And then there's not any pain noted in this little nodule at the third phalange in the center. Beautiful. And then just on that first phalange knuckle, there's a little bit of a nodule, and that's because there's a history of osteoarthritis, right? Okay, beautiful. And then go ahead and turn your hand over, and then go ahead and flex your hand backwards. Beautiful. Any pain or like tingliness rating down when I go like this?
No.
Beautiful. And then go ahead and turn your hand over and flex down and flex up. Good. And then go ahead and put your wrist in a circle. Good. And then we'll do the same with this one.
Oh, that one?
Yeah, good. Okay, perfect.
Okay.
And then we'll move up to your elbows so you can rest your hands. And then go ahead and let me know if there's any pain or discomfort.
No.
Beautiful. So there's no pain or discomfort on either the medial or lateral epicondyles or epicondyles. And then the bursa is intact. There's no inflammation, redness, or heat. Go ahead and flex towards your shoulder and then extend. Good. And then we'll go ahead and try this side. I'm going to switch sides so I can take a better look. Okay. So go ahead and just rest your hand here. And again, there's no pain or discomfort here or here. Beautiful. So no pain at the epicondyles and no heat or redness at the bursa. And then go ahead and extend this arm out and then flex it all the way. Beautiful. And you can bring it back down. Now we're going to test the shoulder. So I'm going to assess it first. Is there any pain or discomfort as I touch you down the shoulder? Beautiful. It might feel nice, huh?
Yeah.
Beautiful. Nice little massage. And then there's no pain or discomfort along the clavicle here. Beautiful. Here's the amicromial notch, or the epicromial tuberosity, and then the cochroid process. And then here's the brachial groove. And then
That feels good.
and the sub delta bursa.
Yeah.
And then good. So there's no pain or discomfort. There's no crepitus there either. Go ahead and lift this hand and scratch the back of your neck. Good. A little crunchy, a little crepitus when you move it back there. And then go ahead and reach behind you and scratch your back.
Oh.
Good.
Well.
Same movement, but it looks good. No discomfort.
No.
Perfect. So a little crunchiness, but no pain. And then go ahead and we're going to do it on this side. So go ahead and reach this hand and scratch behind your neck.
Right back here?
Yeah, good. And then go ahead and rest.
Okay.
And then bring your hand back.
Down.
And then go ahead and scratch the lower back with the same hand.
Oh, okay.
Good. Perfect. So no crepitus on the left side. And then symmetry is intact. And now we're going to test the nearest test to see if there's any pain with mobility. So I'm going to have you go ahead and take this hand and then slowly raise it up. And
Like
then bring it
that?
down. Yeah.
Mhm.
And then try again. Good. Good. Any pain when you move your hand up or down? Beautiful. So we'll go on the other side. And then go ahead and rest it by your
same?
side. Yeah, exactly.
Like that?
Good, yeah. And then any pain as you move it up or down?
No.
Beautiful. Okay. So the nearest test is negative on either side. But this side is crunchy. So you could use a good massage there. No, I'm just kidding.
Okay.
Beautiful. You wouldn't say no to that. Okay, beautiful. So I'm going to have you go ahead and stand up, and I'll have you face the wall. Good. And we'll assess the cervical spine. Go ahead and take a step by the couch.
Oh,
Perfect.
closer?
Yeah, right there. All right. And then so the S spinal curvature is intact. And there is no asymmetry. Shoulders are the same height. And then do you have any pain as I touch down on your spine?
No.
Okay. There is a little bit of a bump here. Any pain here?
No.
Good.
Not since I had a shot, though.
Yeah, you got a corticosteroid injection for your back recently, right?
Right.
How many days ago did you get that?
About 4 days.
4 days, okay.
4 or
Whoa,
5.
it's fresh, so it's real good.
That's right. That's right.
Perfect. And then hips are symmetrical too. And then we can feel the iliac crest right here. So we're assessing this hip right while she's in this position because it's easier. Go ahead and bring your knee up to your chest.
Oh, like that?
Good. And then bring it back behind you.
Oh, just go back like that?
Yeah, perfect. And then the other side. Perfect.
Okay. Just up
Yes, and then back.
and then back.
Yeah,
Okay.
good. And then perfect. And then I'm going to have you go ahead and bend over. And I'm going to go ahead and have you go, if you can
How
go.
far do you want me to go down to the ground?
Yeah, if you could go down a little bit lower, perfect. And then I'm going to quickly touch your spine while you're here.
Okay.
Good. And it's straight. You can go ahead and slowly stand back up. Good.
Okay.
And there's no spinal curvature deformities. It's really straight and beautiful. And then I'm going to go ahead and have you turn to your left side using your hips and your other sides, like doing the twist.
Two.
Do the twist. Perfect. Awesome.
Just need more music.
I know. So that's the only thing we're missing. I'm going to have you go ahead and take a seat
Okay.
on the couch, and then I'm going to have you lay down.
Oh.
So, yeah, you can pick whichever side you want to start with. Perfect.
Oh, okay, this way. Alrighty.
There we go. And we'll put this, perfect. And I'm going to put this underneath your knees for you.
Okay.
Good. And then while you're here, we're going to go ahead and chest your knees out. So go ahead and take the heel of your foot and put it to your knee.
Okay.
Good. And then rest your hip out to the side as far as you can go. Good. And now bring it back up and then hold it with your hands to your chest.
Oh, to my chest?
Yeah. Do you feel any pain in your back or in your legs while you're doing this?
No.
Okay, beautiful.
Amazingly.
Right? And then go ahead and you're going to bring this one back up to you.
Okay.
And then you're going to go ahead and try and cross it over this knee if you can. With this knee over this leg.
Oh, like that?
The other direction. So bring this knee over towards the back of the
Oh.
Yeah, there you go. Good. And then you can rest and then bring it back down.
Okay.
And then we'll do the same thing with this side. Well, we'll do that one next. Never mind. We'll hold off on that one because the couch back is in the way.
Okay.
Perfect. And then I'm going to have you go ahead and put your foot on the bed for me.
Uh-huh.
And then raise it up.
Okay.
Perfect. And then I'm going to go ahead and try and put it in like it's a lock and key. Let me know if there's any pain or discomfort.
No.
Okay, beautiful. Beautiful. And then I'm going to hold your foot and pull it outside. Is there any pain?
No.
Good. So this is varus and valgus. There's no pain with that. And then we're going to do it to this side. So here's out. And we're out. Any pain or discomfort with that?
No.
Varus or valgus? Okay. Beautiful. And then go ahead and rest. And then go ahead again, put this knee on the foot on the bed. Good. And then we're going to go ahead, and this is the drawer test. So we're going to go forward and backwards. There's no indication of drawer motility. And then I'm going to assess the lateral meniscus and the medial meniscus. Any pain or discomfort when I'm touching?
No.
Okay, beautiful. And then go ahead and lift this leg up, and you can put it on my lap.
Oh.
Beautiful. And then I'm just assessing the popliteal pocket, and there's no cyst there. Beautiful. And then I'm going to take a look at her ankle. So I'm going to take your sock off.
Okay.
Beautiful. There is a little bit of discoloration here. And you mentioned that this was due to a history, like an injury in the
I
past.
broke my ankle. Yeah.
Yeah, a broken ankle. So there's some residual broken vessels here that you can see, but no current like warmth or swelling noted. And how long have you had this discoloration for?
Oh, geez, 15 years?
Yeah,
maybe,
15 years.
Or more.
So there's no change in the coloration here
No,
since then. Okay,
no.
perfect.
That's the way it's always been.
Perfect. I'm glad it's not new. And then there's no pain when I'm touching here. The lateral malleolus and the lateral malleolus. Beautiful. And the Achilles. Any pain there? Beautiful. Okay, go ahead and flex your toes towards your head. And then push down on my hand like you're pushing a gas pedal. Good. And then rotate your ankles. Beautiful. And then go ahead and open your toes.
No.
If you can. And then close your toes. Good. And then curl them.
Okay.
And then flex them.
Okay.
Good. And then I'm going to just look at your toes, your little phalanges, your metatarsals and metatarsals. Beautiful. Beautiful. And then there is a little bunion here on the inner foot.
I got bunions.
That's fair. That must be uncomfortable.
Well, it goes in the family.
That's fair, yeah. It is hereditary. Beautiful. Okay, so we're done with this leg, and now I'm going to have you sit up, and then we'll swap sides, okay?
Okay.
Beautiful. And then we'll move this out of the way for you.
Yeah. Sit right here.
Perfect. Yeah, and then I'm going to have you go all the way so the feet are on this side.
Oh.
Yeah, we're going to lay down again, because we got to look at this leg now.
Okay.
Perfect. And then go ahead and lift your knees for me. Beautiful. And then I'm going to, better? Do you need another pillow for your back, or are you okay? Okay.
I'm fine.
Perfect.
Yeah, I'll move this one. Yeah.
Okay, perfect. So now we're going to do the fever test again. So you're going to bring your knee to the heel of your foot to your knee. And then rest this hip all the way out. Beautiful. And then is there any pain in your hip or back?
No.
Beautiful. And then go ahead and put it back to your face. And then pull it back and hold on to it. Give yourself a hug. Any pain in your leg or in this leg?
No.
Beautiful. And then go ahead and take this knee and try and move it across the body. Beautiful. And then bring it back down. Great. And then I'm going to feel the medial meniscus and the lateral meniscus. Any pain or discomfort here?
No.
Beautiful. And there's no Baker's cyst noted on this leg. And then we're going to go ahead and I'm going to lift this and try the Lockman test, where I see if there's any little bit of crepitus on this knee, and that's normal. Good. But no pain or discomfort? Okay, good. And then go ahead and bend your knee for me. Good. And this is the drawer test. And we will, the anterior drawer test and the posterior drawer test. And that's negative. No mobility. Any pain when I move it around?
No, that feels good. You can do
You
it.
keep doing it good. Okay, perfect. Go ahead and lift your leg for me.
Okay.
Good. And I'm going to take your ankle. And we're going to take a look at your ankles now. Beautiful.
Right.
Okay. Go ahead and put your toes towards your face.
Towards my
Yeah, towards your face. And then push down like you're driving a car.
Yeah.
Good. Oh, you got a strong foot. And then go ahead and roll your ankles for me. Good. Good. Awesome. So there's no crepitus on either the lateral malleolus or the medial malleolus. And there's no discoloration here. Just a little bit of varicose veins, but just a sparkle. Nothing like a sprinkle. Nothing like the discoloration that you have on the other foot. And then there is that bunion here on that greater toe as well. And then we're just going to feel your toes, see if there's any pain. Beautiful. Good. Any pain or discomfort? Good. And she has a great arch, so I'm not concerned about flat foot. And then, beautiful. So I'm going to have you put this foot back on, this sock back on.
Okay.
Beautiful. And then I'm going to check your, beautiful. How's that feel?
That's good.
Good. Okay. Great. Thank you so much for all your help today. That was it.
That's it?
Yeah.
Wow.
Perfect. I know. Not too bad.